Doctors, welcome again. Today we are going to discuss here about RUHS MO paper 2020. First question: what is the main difference between case control and cohort studies? So all four options in front of you. I'm not going to read options here, so you have to answer which one is the best answer. So best answer for this situation is case control is retrospective, whereas cohort is prospective study. Cohort for new cases. Okay, I hope it's clear now. Second question: 40-year-old woman with a history of multiple sclerosis. I'm fine. Multiple sclerosis come to the hospital. She describes an electric shock like sensation radiating down the back into the legs. What is the name of this sign? If you know the name of the sign, that means it's very easy. So answer here is Hermit sign. Okay, now which among the following is called transient hypopion syndrome? So here the answer is Hypopion syndrome seen in Behçet's disease. In the Latham life cycle, choose the second stage larva which develops in Cyclops. So the best answer here is in second stage larva is procercoid larva. Procercoid larva. Now, which of the following drug causes induction of microsomal enzymes? By which drug? Try to answer in the comment box. The drug which induces induction of microsomal enzyme is phenytoin. Answer is phenytoin. India is which stage of demographic cycle now? The answer here is India is late expanding. Late expanding. Now, Miss P. MSP diagnosed Miss P diagnosed with systemic lupus erythematosus is undergoing baseline evaluation. What is the most common cardiac manifestation in this condition? The most common cardiac manifestation for in SLE is pericarditis. Remember, it's pericarditis, not Liebman-Sack. Now, okay. Washerman test is for seventh answer is pericarditis. Washerman test is for complement fixation. Washerman test is for complement fixation. Yeah. So hope it's clear now. What is the mechanism of action of vigabatrin? Mechanism of action of vigabatrin is inhibits degradation of GABA. It mainly inhibits degradation of GABA. Patient develops severe cough while performing the cold calorie test on him. Which one of the following now? Cold calorie test on him. Which one of the following now attributed to this? Answer is for 10th MCQ. The nerve which responsible for severe cough while performing cold calorie test on him. The best answer here is auricular branch of vagus nerve. Auricular branch of vagus nerve. Now, while removing a fish bone stuck in the throat. The main trunk of internal laryngeal nerve was severed. The bone was stuck in which part? All four options in front of you. So, the bone is stuck where? The bone is stuck in piriform fossa. Bone is stuck in piriform fossa. D answer. Radio frequency waves are used in which of the following investigation? Radio frequency wave is mainly used in MRI. Radio frequency wave is for MRI. Now, which of the following level prevalence are not matched correctly? Salt restriction in children primordial prevention, crutches in polio tertiary level, DOTS primary level, pap smear secondary level of prevention. So answer is, yeah, DOTS is not a primary level. Answer is this. A woman with a history of diabetes for 10 years with poor glycemic control has come to you facial puffiness. She has purple striae on her abdomen and central obesity. What is the most common cause of this syndrome? Woman history of diabetes for 10 years, poor glycemic control, has came to you facial puffiness. This is a case of Cushing syndrome. It is mainly due to exogenous drug administration, means outside the drug administration. Now, a lady mother had history of recurrent short abortions for which she was put on anticoagulant. Up until the time of delivery, she underwent a LSCS due to slow progression of labor. On birth, the child seemed to have small limbs and nose. Comparison to the trunk. On X-ray, it seemed as if the child was some holes in the epiphyseal region, the humerus. The drug which may cause this. The drug which causes this is warfarin. The drug which causes this is warfarin. This is a case of warfarin, yeah. Following type of audiogram is seen here. The audiogram which is seen here is for early stage of Meniere's disease. Okay. Patient age 71 years presents to you with the complaint of loss of speech and right-sided weakness for the last 1 hour. His blood pressure 170 by 100. He is a known hypertensive and a smoker. There is a history of falling down from the chair. What is your next step? What is your next step here? I hope you understand the diagnosis. Diagnosis here is hemorrhagic stroke. This is a case of hemorrhagic stroke. So what is your first best step? So the first best step in this question is no. In hemorrhagic shock, if you start thrombolysis within 4 to 5 hours, SAI-SK, go with CT brain, because this is a case of hemorrhagic stroke. You have to decrease the intracranial pressure and to prevent the midline shift. Okay, mannitol we can advise, sometimes steroids we can give, or to stop bleeding. Yeah, this is a case of hemorrhagic stroke, because see this question, 71-year-old man complained of loss of speech and right-sided weakness from last 1 hour. He is hypertensive and a smoker, and there is a history of falling down from a chair. 1 hour back he is fall down from chair. That's why there is some trauma, we can say, or Now, liver lesion, multiseptate cystic areas with eggshell or mural calcification on CT scan is suggestive of. So, question number 18, best answer is hydrated cyst. The best answer is hydrated cyst. Yeah. Best one answer here is hydrated cyst. Now, polypoidal mass in a middle ear which bleeds heavily on touch in a patient with a history of hearing loss and tinnitus is due to. This is mainly due to glomus jugulare. This is mainly due to glomus jugulare. Now this question is very easy, 20th question. Creamy white watery discharge with fishy odor from vagina. Fishy odor from vagina, no need to watch options. If somebody has watched my lecture on vulvovaginitis, that means they know. Fishy odor is seen in bacterial vaginosis gardnerella. This is Gardnerella bacterial vaginosis, not Candida. Okay, fishy odor is smell seen on Gardnerella vaginalis. Okay, what is the length of prosthetic urethra? If somebody is watching my lecture about urology, there I explain everything in urology. Urethra has part: prosthetic urethra, membranous urethra, penile urethra, bulbar urethra. So prosthetic urethra size is 4 centimeters, guys. Size is 4 centimeter. They are asking the part of urethra which is prosthetic urethra. If complete urethra, the size is 15 centimeters, but only prosthetic urethra size is 4 centimeters. Yeah, 4 centimeter is the best answer. Now, which of the following anti-cancer drug which known to cause side effect of hemorrhagic cystitis? If somebody watch my lecture about Hodgkin and non-Hodgkin lymphomas, there I explain the side effects of cyclophosphamide. So cyclophosphamide is a drug which causes, the side effect is hemorrhage. X-ray view used for optic canal, that is rash view. If somebody watch my lecture about paranasal sinuses, there I explain everything. So answer is rash view. All of the following drugs used for medical management of ectopic pregnancy except misoprostol, methotrexate, potassium chloride, or methotrexate or misoprostol. If somebody watch my lecture playlist about 500 important topics, there MCQ I already discussed this same MCQ. So answer here is misoprostol. Yeah, answer is misoprostol. Now, all MCQs nearly from my channel. A patient with complaint of loss of vision has been referred to you by ophthalmologist. On further inquiry and examination, he has jaundice and also difficult in initiating movements along the fine tremors. What is the screening test of choice for this disease? Liver biopsy, serum ceruloplasmin, serum free copper, urinary free copper. So answer here is, what is the diagnosis here? Firstly, write the diagnosis. This is a case of Wilson disease. So the best answer here is urinary free copper. Screening test of choice they are asking, not gold standard. So urinary free copper is the best answer. Urinary free copper. Yeah. This is a case of Wilson's disease. Everybody Right. Now, which is the most abundant glycoprotein in basement membrane? The glycoprotein abundant in basement membrane is the glycoprotein which is abundant in basement membrane is collagen 4, heparin sulfate, fibronectin. In answer sheet they gave answer is laminin, but collagen 4 is also right. Collagen 4 is also right, but they are asking most common, that is laminin. Okay, 60-year-old diabetic presented with severe pain in ear and otorrhea not responding to antibiotics. On examination, granulation tissue is seen in EAC. Facial nerve palsy was present. What is likely diagnosis? All options in front of you. Yeah, malignant otitis externa, MOE. Absolutely right. This is a case of malignant otitis externa. Now, the intercostobrachial nerve communicate with medial brachial cutaneous nerve, first intercostal, long thoracic nerve, thoracodorsal nerve. So the best answer for this case is 28th question. The best answer is costobrachial nerve communicate with, yeah, medial brachial cutaneous nerve is the best answer here. Okay. Non-case of tubotympanic disease was taken up for surgery, and on examining the middle ear, few chalky white deposits were found between the ossicles. What is the diagnosis? What is the diagnosis here? Answer here is tympanosclerosis. 20-year-old woman with a primary amenorrhea with short stature and shield-shaped chest, absent breast development. What is likely cause of her amenorrhea? So what is the diagnosis? Write in a comment box what is the diagnosis in question number 30. What is the diagnosis? We are not going in. This is a case of Turner. Yeah, Turner syndrome. This is a case of Turner. So this answer here is hypogonadotropic hypogonadism. Answer is A. Hypogonadotropic hypogonadism. So A is the answer. Now, Kishan disease is caused by a severe deficiency of. I hope this is a simple, direct one-liner. Everybody knows the answer. Try to answer in a comment box. So, what is the best answer here? Jasbir Chima, call me tomorrow at 10 a.m. regarding your problems. Okay. So answer here is, this is selenium. So here the answer is selenium. 40-year-old female was sent to radiology department for thyroid USG scan. Which probe will be used in thyroid scan? The probe which is used in thyroid scan is 32 question. If you want, you can write in so many my videos. My number is mentioned 6378352151. Answer is linear probe. Yeah, absolutely right. Linear probe. All of the following structures are pierced by the parotid duct except buccopharyngeal fascia, pharyngobasilar fascia, buccal pad of fat, buccinator muscle. Not pierced parotid duct. You can write down, I can write my number here, 6 3 7 8 3 5 2 1 5 1. This is my mobile number. If some doctor wants to join WhatsApp group, this is the WhatsApp group number also, 6378352151. Now, so question number 33, answer is pharyngobasilar fascia. Yeah. Now, incidence of cancer increase in old age due to, why there is increase in incidence of cancer in old age? Why there is increase in incidence? It is due to telomerase reactivation, guys. Answer is due to telomerase reactivation, not deactivation, mainly reactivation. Telomerase reactivation is the answer. Now, which artery forming Kishiel plexus is not a branch of external carotid artery? Sphenopalatine artery, greater palatine artery, superior labial artery, anterior ethmoidal artery. So which one is the best answer here? D, ethmoidal artery. Now, at the end of 1 year of age, number of carpal bones in the skigram of hand is, somebody already answering. The answer here is 2. What is the most common cause of peritonitis in adult male? Most common cause of peritonitis in adult male is, anybody? Yeah, duodenal ulcer perforation. Which of the following is the most likely ovarian cancer to develop in a woman with endometriosis? Clear cell carcinoma, serous cyst adenocarcinoma. Which one is the best answer? Ovarian cancer developed with a woman with endometriosis. Answer is clear cell carcinoma. What is the most common mechanism of vascular leakage in acute inflammation is? So what is the best answer? Acute inflammation, the best answer is contraction of endothelial cells. Answer is contraction of endothelial cells. The dye used for the diagnosis of esophageal perforation, that is iohexol. Even I discussed such MCQs already 3 years back. What is the best method to measure HbA1c? The best method to measure HbA1c is electrophoresis. Answer is electrophoresis. Okay. Now, which of the following tumor antigen correctly paired with its ovarian tumor of malignancy? CA19 9 mucinous epithelial ovarian cancer, CA19-9, is also associated with pancreatic carcinoma. AFP dysgerminoma, AFP associated also with hepatocellular carcinoma. SCG granulosa cell tumor, it's SCG also associated with testicular cancer. So which one is not measured properly? Answer here is A. It's C19-9 mucinous epithelial cell cancer. Now, in the Dhanush program is related to immunization of which group of population? Indradhanush program is related to immunization of which group of population? Pregnant women and children up to 2 years of age. Answer is A. Answer is A. Okay. Now, spontaneous non-traumatic bleeding can occur when the platelet count fall below the number of A. It's 10,000. Below 10,000 there is an increased chance of bleeding. Yeah. Now, what is the classical triad of Budd-Chiari syndrome? Even this I explain. Revision one day before exam playlist. If somebody watch the lecture about Budd-Chiari syndrome which I deliver, they know the answer. Answer is hepatomegaly, abdominal pain and ascites. Now, a child of Down syndrome presents with sudden onset of weakness of all limbs. On examination, there is hyporeflexia of all limbs. Which of the following characteristic of Down syndrome could have predisposed the child to developing this? Mark the one with the highest risk. So the best answer here is it's A. Atlantoaxial instability. Atlantoaxial instability. Now, in which of the following reaction carbon monoxide is released? Heme to biliverdin conversion. Which one? Options in front of you. Try to answer in a comment box. Which one? Answer is heme to biliverdin conversion. Okay. Now, during first week of infection, dengue can be best detected in clinical practices by. Answer is NS1 antigen. Microalbuminuria, all options in front of you. Which option is best for microalbuminuria? Which option is best? When we can say microalbuminuria, that is 30 to 300 milligram of protein per 24 hours. Hemorrhage after thyroidectomy is most commonly due to injury of. What is the single best answer here? After thyroidectomy, which artery responsible for hemorrhage? Hemorrhage after thyroidectomy. Answer is superior thyroid artery. 50 MCQs I already discussed. Remaining 50 MCQs tomorrow I am going to discuss. Same time, 5 past 11. So guys, if you like my videos, put like on it. If somebody is new on my channel, they can subscribe my channel. And if you want to join my WhatsApp group, you can join for more updates for MCQs, high yield I am going to share there. So thank you for watching my lecture and good night. Have a good sleep. Tomorrow next 50 questions I am going to discuss. So goodbye. Good night. That's all for today.